Good morning everybody. I am Dr. Gopika Rajesh, practicing obstetrician and gynaecologist, laparoscopic surgeon and infertility specialist from MULTI Speciality Hospital, Bangalore, Bangalore. Today's topic is about polycystic ovarian disease, which in routine terms is called as PCOD. What is PCOD? Why haven't we heard of PCOD in earlier days? Why is my child suffering from PCOD when I am all right? These are the questions that we usually get from the parents when they get their teenage kids for regular checkups. So PCOD is a multi-syndrome disease wherein there are abnormal physical characters, abnormal hormonal changes, and abnormal lifestyle patterns in teenage women or in reproductive age women between 14 to 30 to 35 years of age. So what are the physical characters that are associated with polycystic ovarian disease? How do you pick up first this polycystic ovarian disease? This can be diagnosed on regular ultrasound when the patient comes with heavy menstrual bleeding, or when a person comes with not getting menstrual cycle for the past 1.5, 2 or 3 months. Then on regular ultrasound, we diagnose something called polycystic ovarian disease. What is polycystic ovarian disease? What are the physical characters of polycystic ovarian disease? Physical characteristics of polycystic ovarian disease is, once we see the patient looks a little obese, especially the weight is more on the lower abdomen and on the thighs and in the arms. The second physical characteristic of PCOD is unwanted hair growth, which is called hirsutism. This unwanted hair growth will happen mostly on the upper lip and in the chin area, sides of the cheek, and sometimes on the lower abdomen, lower back, and on the legs. So these people frequently use anti-depilating agents, or they use laser to remove their extra hair growth. The third feature that we notice in these people is because of the dominance of male hormone, which is called testosterone. This testosterone excess, where from it is produced in PCOD patients? Because this PCOD is an estrogen dependent symptom. So whenever these women produce a lot of estrogen, this estrogen gets converted in the subcutaneous fat into testosterone, which is a male dominant hormone. Because of this testosterone, these people usually have multiple acne, even on the face, even on the back, and even on the legs. They get multiple acne, and these are very painful, and they secrete a lot of sebum, and then they leave scars or small marks on the face, which their children don't like. The fourth symptom that can happen with PCOD is acanthosis nigricans, which is dark pigmentation of the skin on the sides of the nose up to the level of the mouth, angle of the mouth, and sometimes on the back of the neck, nape of the neck, and even on the neck area. We feel like it is looking like dirt, but then it is because of hormone called melanin, which is in excess production in PCOD patients. This is called acanthosis nigricans. Then why is that PCOD is happening in the present day? The PCOD is happening in the present day for people is because of, first, lifestyle modification, second is lifestyle changes, third is again the lifestyle change. Why lifestyle is changing is because, first thing is, the women are not doing any manual exercise like how it used to be with our parents, our grandparents, our great grandparents. They used to do a lot of manual work at home, and they used to eat very less junk food. Like, they were never used to eat excess oil, they were not eating excess maida, they were not eating junk. They used to eat everything on proper time and proper proportion. But now that the children are studying for a longer duration, or watching television for a longer duration, or working in the call centers, or any other issue, the lifestyle of the female has changed. See, children used to go to sleep by 9 p.m. earlier, but now the children are sleeping at 11, 12, and sometimes if they are working or closer to the exams, they are sleeping at 1, 2 a.m., wherein you tend to eat and drink something which is adding on to your routine fat. So lifestyle modification and weight loss forms the first stage of therapy in PCOD. The second stage of therapy in PCOD is metformin. What happens? What are the associated abnormalities associated with this PCOD? What are the associated hormonal changes that can happen with this PCOD? Is one thing is insulin sensitivity. What happens with the insulin sensitivity? There is increased hyper sensitivity of insulin, which means to give a normal range of glucose of 80 to 140 milligram in any female. Normally, if you require about 6 to 25 units of insulin, in PCOD patients, the same insulin can go up to 60, 80 and sometimes 100 international units. You are not overtly diabetic, but you have something called impaired glucose tolerance, for which you can put on metformin, which can be consulted by your doctor and can be taken on individual basis. The second stage of therapy is weight loss. As long as you are losing weight, the PCOD doesn't harm you. And it is very tough to lose weight in PCOD people because their basal metabolism itself is very low. Wherein a non-PCO patient is eating the same diet and a PCO patient is eating the same diet, but the non-PCO patient loses around 1.5 to 2 kilos a month. The PCOD patient loses only 600 to 700 grams a month. That means they need to work hard, they need to diet hard, and they need to bring a drastic change in their lifestyle for them to lose weight and maintain their hormonal status. So the mainstay of therapy with PCOD lies in lifestyle management and weight loss management and treatment of other associated abnormalities like insulin hypersensitivity and associated thyroid disturbances, associated prolactin disturbances and other things. Suppose say if you are infertile and you are having PCOD, then there is something called laparoscopic ovarian drilling which can bring your hormones at a temporarily lower level and allow you to get pregnant as early as possible. For further details on PCOD and for infertility management, you can contact me in AV Multi Speciality Hospital, Bangalore, Bangalore. We'll be happy to help you out with your doubts and help you to guide with the treatment. Thank you.